I am Brent Evans, an electronics technician. I'm talking with Dr. Michael Zucker, a retired alternative medicine doctor who now consults on chronic disorders. Dr. Zucker, what are your thoughts about the current approach to cardiovascular disease?
Well, hello, and it's nice to be here. My feeling about the current approach to cardiovascular disease is mixed. Some good, some not so good. First thing we should really talk about a little bit is location of plaque. Obviously, the biggest issue right now has to do with plaque in the heart, in the coronary arteries, deliver oxygen to the heart muscle. Now, there's also a substantial issue about plaque buildup in the brain area, and that can cause strokes. That's a little harder to deal with. You can't easily just go up in the brain and do things. The main thing we should talk about has to do with cause. What really is cause of plaque? Plaque is actually a rather complicated bunch of stuff. It's not just real simple, like, oh, it's cholesterol and sitting there and it just gets more and more and it clogs up. In actuality, the first thing that happens when you have the blood beating against the worn out coronary artery is you get a little bit of a damage to the lining. And the body seeks to repair this. And the first thing is it brings in something called platelets, which are little bitty things in the bloodstream to plug the leak. And after that occurs, you get the formation of further materials designed to plug the leak and seal it up real well in a healing response. These other things are such as clotting factors in the blood, white blood cells, and you have cholesterol, you have fatty acids, and finally, you can have calcium, or occasionally even bone that's laid down to really lock it up. So the real issue is, why does this process keep on going? And in actuality, cholesterol gets an awful lot of blame, but it's not the real culprit. The real culprit is the failure to stop plugging up things when it's already been done fairly well. And this has a lot to do with other factors, especially thyroid hormone action. Because thyroid hormone is secreted, has many actions, including getting the metabolism rate up, but it also is the main control over healing, tissue regeneration, and repair. And so if there's damage to a coronary artery and plaque starts to form, it starts out with the things I mentioned, but if there is not enough stimulation with the hormone, what happens is the process is just a runaway train and it keeps on trying to lay down more protection. And eventually it blocks a vessel. Now, I would like to first of all say that although I'm an alternative practitioner, I'm also a board certified specialist in internal medicine. And I've done that as well as any alternative approaches. I think that there have been miraculous improvements in the care of advanced cardiac disease with hardening of the arteries. Surgery and bypass has been quite excellent. And of course, you have a lot of drugs that have come into the picture. And many of them are life-saving and very valuable. But you have to understand that these are late-stage treatments. They don't stop the cause, and they don't really deal with the early stages. The preventive approaches suggested by standard medicine are really not quite right. They're big on cholesterol reduction in the diet, but studies showed 20 years ago that it doesn't make a difference. Body makes all kinds of cholesterol, every cell, and it's an important material for the body, for formation of hormones, and also intermediate compounds used in the metabolism. So it's not something we should try to get down too low because it may make the body not work right.
You mean cholesterol is not the culprit, as we are told?
No, it's just a player. We've already discussed that there are all these other players. Now, I would like to also state that the reason the cardiac area is affected so heavily with plaque is that there are a lot of tight bends in the coronary artery system. And where there's a tight bend and the blood is squeezing by in these little capillaries and in the bigger vessels, you've got a lot of damage that occurs, wearing out on the lining, and that starts the process. The veins don't have a lot of sharp kinks, and they also don't have as heavy flow rate, so they are not affected by plaque. What happens when you take a vein and you use it to bypass a plugged artery is that you put it into the path of this high stream and pressure flow. And the veins can then start to build up plaque as well. Now, the big approach with medication in the recent years has been the statin drugs and other types of things that block the formation of cholesterol and its byproducts. And what you want to do here is try to achieve a decent level of cholesterol, which won't cause trouble. And, lots of studies as well as population studies have shown that a good cholesterol level of 180 or to 200 is really pretty normal. Unfortunately, since the standard medical docs have given up pretty much on diet because cholesterol reduction and intake of various oils does not really work very well, they have now decided they have to rely really on drugs. And the statin is the main thing, and they try now to push it down to extremely low levels, with the idea is that will stop the plaque. It doesn't really. It may help some, but it has substantial risks. If you stop the production of cholesterol, you will also get a stoppage in the production of something called coenzyme Q, which is very important for your metabolism and your muscles and their function. And so some people get into real trouble with muscle damage. Also, there have been some questions about increased cancer risk from statins. So I think it's a mixed blessing. I think that one shouldn't try and push the cholesterol level very low, like 120 or less. I think there are too many risks.
Then what other approaches are there?
Well, I do believe that prevention is important. Now, what do I mean by that? We mean doing something that stops a cause. It's not prevention of a cholesterol elevation. Basically, diet is the first line of attack. And I espouse or believe in a diet which is what I call proof, P-R-W-F, proof. And that stands for P, means pure, such as not a lot of chemicals, organic things. And second important thing is raw. Well, we know what that is, not cooked. And the W stands for whole. You should try to get in whole food when possible. And F stands for fresh, not old stuff that's lying around a long time. Obviously, processed food as a whole falls down pretty badly here. So we should try to reduce those kind of wrong things and put in really good things. In addition, most people really nowadays are malnourished to some degree, and I don't mean that as an attack on people. They've been given a lot of wrong information about diet and what the body really needs. And so they don't eat in the best way. And they don't have a very active physical lifestyle. And so they don't take in a whole lot of food and nutrients. That's one of the biggest problems. And so they get worn down in areas such as vitamins and minerals and important other factors. So the use of supplements is quite important in my work. I use megavitamins and minerals. That means high dose because there's a lot of variation in people and their needs. And so you want to make sure there's more than enough to get everything done well. And studies showed back there 70 and 90 years ago what was supposedly the recommended daily amount. But it's really not enough for best function or even really good function. And I've done a lot of nutritional analysis by computer, and you find that everybody has some deficiencies, even with the government figures. It's a sad fact, even if a person is pretty physically active. the quality of our food supply has declined.
Is proper nutrition enough to reverse hardening of the arteries?
Well, it may not be enough to reverse it, but the main thing is to stop the progression wherever it is. There have been a certain number of studies done. There was a Dr. Ornish up in Northern California, did one about 30 years ago or more, using pretty much a high fiber type diet without a lot of junk. And it was possible to show on actual examination, x-rays, etc., that it was able to reduce plaque. I think that's pretty substantial. I think that you have to understand that diet is a first line approach, and you observe people's symptoms as you go along. Now, I think that in addition, it's very valuable to check out some other things. I am a firm believer in the use of hair analysis. Hair analysis tells about your toxic metals in the body, chronic buildup. That means things like mercury, lead, aluminum, nickel, cadmium. These are very bad actors, and they cause serious degenerative change. We want to stop that. Also, the minerals tell us if you have the right stuff in your body to make your enzymes work and your chemical reactions and metabolism go. Very important, including your repair mechanisms. I also feel that if people have advanced vascular disease and they don't really want to have surgery, or it can be controlled maybe a little bit and not run to have these invasive procedures, there's a place for chelation therapy. Now that means you put something in the body that sucks out toxic metals. These are dangerous items, and you want to get rid of them, and you can do it fairly quickly. We're not talking about days, but we're talking about a matter of months. And studies have been done more recently on that therapy using intravenous approaches, and they did show that it does work and reduce the vascular problem. I have found that you can get equally good results by using an oral preparation at home. This is called Metal Free, one brand, and I've been using it for approximately 35 years. I've mentioned the issue of thyroid. Sometimes people's metabolism has gotten very slow, and they may need to have additional thyroid hormone in order to push things through and make the reactions of the body go at the proper rate.
High blood pressure is also quite common. What causes this?
And that's a complicated question. There are two basic problems here. I like to say that we live in the ESA, the excited states of America. We take a diet that is fairly stimulating. You know, there's caffeine, there's sugar, there's all kinds of processed foods, things that the body hasn't really seen that much of in old times. Now, these kind of stimulations can cause the nerves to discharge a lot and the muscles to twitch and cramp. Now, obviously, high blood pressure means there's too much pressure inside the blood vessel, the arteries, and therefore it reads as pressure on the walls of the vessel. If you start cramping the little muscles that control the size of the vessel, you'll be raising the pressure inside. So this is a very big piece of the problem, especially in the younger people. Now, of course, as time goes by and people get older, they tend to develop plaque. And if plaque gets substantial, it makes the vessel rather rigid and hard. So it's called hardening of the arteries. So that can cause the pressure to go up. When you put on the blood pressure cuff, you have to pump it up higher to actually shut off the flow and measure. That's what they do. Now, if you want to try and deal with the high blood pressure, the first approach in any case, I feel, should be nutrition and not just salt reduction or even losing some weight. Quality materials, things the body really needs for smooth function and reducing the overstimulation. It's kind of like I said before about the diet. Good quality stuff. In addition, you have to look at the minerals. In particular, you want enough magnesium in the system because it's a natural sedative type material for the nerves and muscles. You generally can observe things when you put this approach in, and you watch and you see, does it bring down the pressure? In most cases, it'll bring it down quite substantially, as much as a first-line blood pressure medication. So I think that's a pretty good approach over at least the short term.
Do you agree with prescription of drugs for high blood pressure?
Well, I do agree that if the pressure gets substantially high and stays high, then there's a place for medication if other natural approaches haven't been very helpful. And one has to decide, well, what is too high? The old line, pressure of 140/90 was considered that borderline. Now they're saying that that's too high. And it is not normal, but the risk is very low at that point. However, if it gets up high, like 170/100, and it stays up high like that, well, that becomes a risk for the heart, okay? It becomes a risk for failure of the heart because it tires out from pumping against higher pressure. So, they're talking a lot about pre-hypertension, but the goal is really to get people on medication early. I'd rather try the non-toxic approach first.
Do you have a diet specifically for cardiovascular disease?
Well, I have a diet, but it's not really specific just for cardiovascular disease. It's specific for all disease and chronic conditions. I call this the quiet diet. As I mentioned, there is just too much stimulation in people in general, partly due to diet factors, partly due to lifestyle and medications that comes into play as well. So the quiet diet is designed to relax the system, and it does work very well. And with hypertension, of course, you really want to not take in drugs in the food supply that raise it, such as caffeine. This is a big problem and should be the first thing to confront. The supplements play a role, as I mentioned, particularly magnesium and other minerals, but you want to have all the vitamins, etc., that might be necessary for proper function and smooth operation.
What are the risks of high blood pressure?
Well, as I mentioned, the first issue has to do with the heart. The heart can go into failure and back up fluid into the lungs. That's called pulmonary edema. And it can back up into the whole body. And then people are very uncomfortable. Now, obviously, the heart is the biggest concern we have at this point. We also have a lot of issues about strokes and the management of strokes. Early management of strokes can be very easily counteracted if you get in there and you give them something to unblock a vessel. This has recently become possible. Didn't used to be. Other approaches with medications, intravenous, to reduce clotting were used, but now they can actually get into those vessels and squirt stuff right where the trouble is and unblock stuff. Furthermore, there's trouble in the kidneys if the pressure is too high. The kidneys can develop hardening of the arteries of a sort, and it can stop the proper filtration of the blood and removal of toxic substances into the urine. So that can be a serious problem and lead to dialysis, etc.
Does high blood pressure cause hardening of the arteries?
Actually, no, it's the opposite way around. Hardening of the arteries can cause high blood pressure, as I mentioned. It can lead to this plaque formation, but you don't really have a problem with plaque buildup and caused by high blood pressure. That's not the way it works. It's the other way around.
What is the success rate with your program?
Well, I'm pretty happy with how I've done. I've been doing this approach for approximately 40 years. That's enough to see thousands of people and put them on programs. I don't say that we cure everybody. The first goal here, particularly in vascular disease, is to stabilize the situation in the vessels. so that we don't have further trouble. And then you do things that are designed to gradually reduce the condition and repair damage. What kind of statistics have I seen? Well, first of all, I have not had a single person under this program develop a heart attack. Now, that's pretty interesting. You know, there were no heart attacks 150 years ago, even though people ate all kinds of fats. So this is a disease of the industrial world. And so we have to try to detoxify and have good materials for the body to work with. I would say in all my years, I've had one person have a serious stroke while under therapy of this type. I think that's pretty good too.
That's amazing. Thank you for your information, Dr. Zucker.
Well, I like to help people to feel better. And I'm hopeful that there's been some message here that is useful.